Good afternoon. And today we have a pleasure of interviewing a big shot, Miss Samantha Weaver, Director of Academy of Orofacial Myofunctional Therapy. Good afternoon, Samantha.
Hi, Dr. Maria. So nice to be here. Thank you.
And thank you very much to our audience. If you have trouble sleeping or sleep next to the snoring partner, this interview gonna be for you. It's gonna illuminate the area I'm so passionate about, myofunctional therapy. And if you're a medical professional and just like us, looking to find all the puzzles of this disease of evolution called obstructive sleep apnea, this interview, this for you, would be for you. You're going to put together some parts of the puzzle, listening to Samantha's personal story and challenges in the field of integrating myofunctional therapy into everyday life. So thank you very much for listening. And I'm going to tell my story with Samantha. I actually planned to interview Samantha, I would say 2 years ago. We meet at the Academy of Dental Sleep Medicine. And I find it the mission, what Samantha has, really fascinating. So this is a story about Samantha. It's not just a story about myofunctional therapy. Samantha was trained as an actress in a performance study by very prestigious Northwestern University. And she holds 2 bachelor degrees, one in performance studies and another one communicative disorders and science. And then she has a master in the communication disorder, and she became a founding board member of Academy of Myofunctional Therapy. Actually, the Academy who tried to establish license for myofunctional therapy and certification. So basically put myofunctional therapy on a map of treatment orofacial disorders, specifically in the area of orthodontics and sleep medicine. That's what we're passionate about that. And she wrote the book. And book for, she's in the process of writing other books, but this book really occupies special place in my heart because it's explained myofunctional disorders to kids, called the tongue find the spot, and you can get it on Amazon. And also Samantha teaches a lot of courses, and you can check the website of Academy of Orofacial Myofunctional Therapy to train professionals who want to become myofunctional therapists. And the courses are very comprehensive, from oral area to whole posture. So I highly recommend to visit them. So my first question to you, Samantha, please tell me, what is your journey to that field? What inspired you to do what you're doing right now? How you become involved in that field?
Well, like most stories, it's not a linear path. And I would say my path in life from a young age was to tell stories. I was a childhood actor. I had commercials, milk commercials, Swanson's dinners. I was, loving the stage, loving to engage with an audience, that was my path. And so I actually spent 4 years in France in between. And I considered living in France and going to the École Florent, which is a very prestigious theater in Paris. And I thought, no, I should really get my undergrad degree in the US. So I went to Northwestern, and really the performance studies department at Northwestern looked at anthropology and brought stories of the community to the stage. So we did projects around, the crime in South Chicago and the journey of somebody who was in the projects, and brought that story to the stage. So I feel like the path of telling the story of the one has always been what really inspired me, because of the opportunity and the impact for change. And in 2008, the financial crash happened. This is after I had, I worked in London as an actress. I worked in Chicago. I worked in San Francisco. But I really thought maybe I should really get a real job in a way, because the financial crash happened. All the projects that I had in film, everything receded, everything dropped out. And that's why I started looking into speech pathology, because I really felt that the communication was what I was passionate about, and speech and voice and transmitting your message in speech was really what I thought. So at the same time, I met Mark Moeller, who introduced me to his mom, Joy Moeller, who has been doing myofunctional therapy today for over 45 years. But at the time, I had never even heard of it, like many of you. And she brought me to a conference, and I heard Bill Hang on stage, and he talked about his cases. And then he used this term, the face is in free fall. And I looked at the page and I looked at the screen and I saw the profile of the bump in the nose and the long third of the face. And I looked back at myself and I realized that's me. And what happened in my growth and development was an outcome of the other side, which were untreated myofunctional disorders as a child. I had chronic strep throat. I was on antibiotics at least 4, maybe 5 times a year. I had ear infections. I was tested for hearing loss. I was an open mouth breather. I was a thumb sucker. And like most kids, this kind of experience just wasn't acute enough to warrant any kind of treatment. So when I saw Bill Hang on stage in 2009, and I realized the outcome of my entire health trajectory was never treated, and of course, I had retracted orthodontics, and I realized my high narrow palate and my long face and the bump in my nose was really the outcome of not having my myofunctional disorders addressed. And of course, that's just the aesthetic part of it. But what about the sleep and the struggles I had of really staying focused, or just pushing myself to try to maintain and do well in school? And I got by enough. But that moment really crystallized how important it was to address the story of myofunctional therapy. And so it really fueled a higher purpose and a mission, because it was very personal. And I realized as I looked around, everyone had some kind of issue that had not been treated, and there was a solution. And I learned the solution through Joy Moeller. I went on to learn through the Brazilians. I trained in France. I got a lot of wonderful mentors. And through the opportunity of training and teaching, then I realized this really has to expand. And so that was really how I became more involved with the AOMT, and now I'm the director, to really train and inspire through the stories and how these solutions can help parents, children, and of course, medical and dental providers.
This is such a beautiful, I have that philosophical fire in me, and you put it from the community story and the personal story, and it's so much vulnerability. I think it's your story is a great story to inspire, but I agree with you 100%. It's evolutionary moment. And I always I always say that phrase, if we don't want to end up like a dinosaur, so we have to really wake up now and start addressing myofunctional disorders. But I'm going to tell you, I'm going to bring a light on my struggle, how to incorporate myofunctional therapy in the practice. I've been passionate about myofunctional disorders for several years. And for me personally, it's opened a whole new chapter, how I can help my patients who suffer from obstructive sleep apnea, as well as, I've been doing clear aligners since 2002. And, orthodontics was my passion from the start. And I noticed how sometimes people repeat orthodontic journey 2-3 times in life. And now it's, become financially hurtful, but technically very easy to do it over and over. And I was wondering why we put all these retainers and teeth go back. So that being said, I find it so important for the dental office to have myofunctional therapy outlet in the practice. And please tell me, how do you see it can happen?
Well, we have to identify myofunctional disorders early on. So, what is that? That's anything that is essentially an outcome of improper breathing, chewing, swallowing, or where you hold your tongue. And so, the idea is that if you can identify the oral function and see if you can support better practices, which is especially important in the modern day because of our practices, the allergies in response to the inflammatory foods that children are eating and the soft foods. So we really are trying to support dentists because they need the functional aspect addressed so that their treatments will hold. The instability that is innate with somebody who has a myofunctional disorder essentially means that you're always going to revert. It's going to go back to the way it was before the teeth were moved, and sometimes it worsens the outcome because the tongue was not addressed. There may not be enough room for the tongue. Breathing at nighttime leads to open mouth posture if that nose is occluded or sensitive to dust, dairy, dander, anything in the environment. So we're really looking at the function. The dentist would be so supported when there's somebody addressing the function so that all these treatments can really hold and do what they're meant to do.
Yeah, that's a beautiful way to say. But tell me, why is it so important to address, orofunctional, myofunctional disorders in orthodontics specifically and dental sleep medicine? I know you mentioned it in the previous answer,
Mhm.
but since it's still, unknown area for a lot of people, why is it so difficult?
Well, the difficulty is that we're addressing the advanced disease state. So that means the crooked teeth, the sleep disordered breathing, the TMJ dysfunction. These are actually advanced disease states that had an origin of dysfunction very early on. So the idea is that if you can address function in the proper window of growth and development, when the face is pliable, the bones are more responsive in terms of not as hard and dense, you can really augment the trajectory of health in a foundational, crucial way. So the child that shows up at age 12 with crooked teeth or an open bite or a cross bite, it didn't just happen. It's because over the years and years of that tongue or nose not functioning properly, not doing what it's designed to do, the outcome was not enough space for the teeth, the high narrow palate, and essentially you're trying to straighten teeth when there was all this opportunity that could have really helped that child. And by the way, less intervention early on is really what happens, because when you wait, the treatment intervention really starts to go up. You have a longer period of treatment. You have to try to get this whole skeletal frame out of a compensatory pattern, because the tongue is guiding the face, but it's also the rudder of the spine. So the way you breathe is actually going to affect your whole skeletal development. And when you don't breathe properly, meaning your mouth breathing, you see people starting to extend their head forward, their cervical spine starts to compress. And then you add other modern day realities such as the tablets and iPhones and, looking down, you have a lot of, we're kind of swimming upstream in the modern day reality. So if you can intervene before these conditions snowball into a disease or malocclusion, then you really are guiding the health and growth. Of course, treatments can happen later in life. And, that's going to be my next chapter of my own journey, because I am going to need to address all of this. But it does have to happen early. And dentists are in the best role, dental hygienists who see the patient, dental assistants who can work with the team. I really believe that we can give more to the patients if we work together.
No, that this is beautiful thing. And I think it's going to bring much more satisfaction and less burnout if you have control of the treatment in a way and you see your impact. It's going to bring new wave of inspiration to come to work. I'm talking about, dentists as well, but dental professionals, dental hygienists, administrative staff, and dental assistants, of course, they can see the result of their work. You change somebody and somebody has less infection. So it's a really, nice way.
I feel like we're at a tipping point because there's been much more advancement. Even the word myofunctional therapy, nobody could even say that 10 years ago. What is that? It was a branding problem. Now, many more people have heard of it because people are carrying the message, including James Nestor, who wrote the book Breath. So, I love this book because it's like sitting down with James Nestor, who's a great writer, have a beer and learn about the physiology of breathing. It's very accessible. And so I always recommend this book. And I always find that people have come to us because they're naturally interested in what is happening with the body. And it's not being taught in the medical dental curriculum. So people are really looking for it in these other channels. This podcast, for example, people are looking for the message that makes sense. They know that they're not getting the full answer by their doctors. In fact,
absolutely not.
Doctors are turning away the idea that there might be a breathing issue. Oh, well, it's not acute. Just wait and see. And that wait and see philosophy is the worst thing that could happen when you have a growing child.
Yes, no, that's so makes sense. And my last question to you would be, what courses are Academy of Orofacial Myofunctional Therapy offering to dental or maybe medical professional to educate them and hopefully to bring myofunctional therapy into their practice?
Well, we start with our Introduction to Myofunctional Therapy program. It's a 9-week virtual program, and dentists can come in, and I find that the virtual format is very accessible. And what differentiates us from many other institutions that are training this is that we really stay with people as they implement. We have 4 events every week that are mentorship hours. They're meant to help people after the course with the next stage, which is the implementation of how this is going to work in the practice. So that would be our first and foremost method. There's so much information. Even the research, we update it in a student resources library of evidence-based research. And, we're really dedicated to fostering all of these connections inside the community, but bringing any topic around myofunctional therapy and sciences to the group. So we have a weekly study club and office hours, etc. We also have a breathing reeducation program that we collaborate with Patrick McEwen. We've been doing that for well over a decade. And we also have a TMD sleep and posture program. And we haven't offered our frenectomy program since the pandemic. So we're looking to how to develop that and offer it again. But we really have other courses that we know clinicians need. And because there's such a wide interdisciplinary community, there's different courses for different philosophies and approach in practice.
Oh, this is beautiful. I really encourage my audience to check your website, to go to the Academy website and check all the courses. I find them very comprehensive, and I'm looking forward that myofunctional therapy become a household name in the future, so people understand how they have to fight this unfortunate evolutionary changes. Thank you very much, Samantha, and we're looking forward to know how it's all unfolds.
Thank you so much. This was so fun.